Hi, I want to talk to you about Crohn's disease. Crohn's disease is a very troublesome disease. I will not talk about ulcerative colitis today. I will limit my presentation right now to Crohn's disease. It's affecting a lot of people. So let's go. Crohn's disease is a part of inflammatory disease that is made up of Crohn's disease and ulcerative colitis. It's common among younger age group people, less than 30 years old, and it affects from mouth to the ends. It inflames the entire thickness of the wall of the intestine, and there's what we call skip lesions. In other words, it affects from the mouth a part of the wall of the gastrointestinal tract, then will create, will jump that a portion that will be healthy, then another portion below will have the lesion. So skip lesions. And there's cobblestone appearance. Ulcerative colitis is common on the left, while Crohn's disease on the right. The causes are still not yet known by many, and they call it idiopathic, but autoimmune is identified in a lot. The risk factors here will be genetic, or some people call it hereditary, but it is possible without any family history. So don't blame it on your parents, don't blame it on your dad or your mom. You might have it without family history. But then if you have it, you need to find out if that is the case in your family. Or if you have it, you might be able to guide your own children to watch it. Um, Over-the-counter painkillers could worsen Crohn's disease. They don't cause it, they could worsen it. Lifestyle management is essential because smoking will worsen Crohn's disease for you. Stress cannot cause Crohn's disease, but will make it worse. So relax. Don't bother your head too much about too many things. That's what we call acute flare. That is when you run to the hospital or you call your 911 for help. This time there's bloody diarrhea, or sometimes you will not even see blood, but you will have pain. You have pain, your temperature can rise, giving you fever. There could be sores in your mouth, and the stool will be, colored differently, banana, or you can even see frank blood in your stool. There are extra-intestinal manifestations of Crohn's disease. I'll talk about that in a bit. Diarrhea here, and of course the bleeding, will lead to weight loss. So affected people may not be gaining weight because they have diarrhea frequently and because they are bleeding. And because of that, they lose nutrients in the body and they become dizzy, particularly when they have anemia or they have hypovolemia. They become weak and fatigued. Oligemia is decreased blood volume, and that is understandable because of bleeding. Oliguria is decreased urine because watery diarrhea, and of course the bleeding would decrease urine volume. And they are prone to frequent falls. Falls because they are weak, they are dizzy, and fatigued. The extra-intestinal manifestations here will be arthritis. Ankylosing spondylitis is not surprising to have ankylosing spondylitis here because it's also an autoimmune condition. And I've said it the other time that when there is one autoimmune condition, you better look out for the rest because they go together. Erythema nodosum on the chin of your leg, gallstones, nephrolithiasis, uveitis, and amyloidosis or sarcoidosis affecting the lungs. And that's why sometimes they are admitted into the pulmonary units in the tertiary institutions. Aphthous ulcers, just check everywhere in the mouth and everywhere. So the fact that this woman is having Crohn's disease doesn't mean the problem is limited to the mouth down to the stomach, to the small intestine, large intestine, and rectum. No, there are other problems that could manifest in other parts of the body from eye down to the toe. How do you make the diagnosis here? Laboratory, as what you call fecal immunochemical test or fecal occult blood test. You can do that first, then do complete blood count, do your electrolytes, and you can ask for calprotectin and lactoferrin. They are used for monitoring inflammatory bowel disease treatment and very helpful in distinguishing it from non-inflammatory processes in the gastrointestinal tract. They are very sensitive. We continue making a diagnosis by doing some imaging, endoscopy, from mouth down to the anus. Depending on where the pain is, you can use capsule, that is wireless capsule endoscopy, and you do colonoscopy if it's down there, along the colon and rectal region. Then you do your CT or MRI. Biopsy is gold standard. So endoscopy with biopsy is the gold standard in making the diagnosis. Treatment of Crohn's disease will start with lifestyle modifications. Stop smoking, please. For Crohn's disease, well, we've read in so many journals that smoking helps ulcerative colitis, but are we going to encourage people to start smoking? No. What can we do then? We can give them nicotine replacement therapy for ulcerative colitis. When I will make the presentation on ulcerative colitis, I will go in more details. You modify your diet, you rest more because stress will worsen the flare for you. So decrease stress, rest more. For acute exacerbation, flares, okay, corticosteroids will be used for induction of remission here. You can use prednisone 40 to 60 milligrams a day for 16 weeks. And you give anti-inflammatory medication like sulfasalazine, immunosuppressant, Remicade, Imuran, Humira, and surgery is not curative in Crohn's disease because of relapse. No, relapse is the same as reoccurrence. But compendium of therapeutic choices, 7th edition suggested that combining infliximab and azathioprine is more effective than using infliximab or azathioprine alone. The treatment of complications will, like, if there's decreased iron, please replace. Decreased vitamin B12, electrolyte imbalance, and depression, treat appropriately, please. Complications. Colorectal carcinoma chances increases with Crohn's disease. Intestinal obstruction is possible secondary to scarring. And of course, anemia, because there's decreased absorption of iron, decreased vitamin B12 or loss of the same in diarrhea, and because of massive bleeding. All this will lead to anemia. There will be ulcer anywhere along the gastrointestinal tract. Fistulas and anal fissure are possible. Enterocutaneous, enterovesical, fistulas are possible. Steroids will likely lead to increased blood pressure. Now, can bring out diabetes mellitus in those that are predisposed. There will be poor wound healing. There will be mania or osteoporosis. So, if you are suspecting possibility of osteoporosis in a young woman that is taking steroids for a long time, you can give vitamin D, phosphorus, and calcium to help. Crohn's and pregnancy. Yes, you can be pregnant. You can have pregnancy. And you can have a normal process for that matter. As a matter of fact, pregnancy helps Crohn's disease because the autoimmune diseases are weak during pregnancy. And you can even have normal delivery. Yes. However, your conception should not be when you have acute flares. So it is advisable to say, wait till you are in remission for about 3 months. You understand what I'm talking about? You have Crohn's disease already and you want to be pregnant. Yes, you can. But you have acute flares right now, you're on treatment. Discuss with your partner. This is not the right time to start the pregnancy. Let me get out of this acute phase, be in remission, then pregnancy can start. So work closely with your physician and your partner to fix this. So it's doable. In conclusion, don't blame yourself, be courageous, and I'm wishing you well. Thanks for listening to my presentations. Please kindly subscribe so that you can get these presentations immediately they are published. Thank you.